You know, I was born in Houston. Both my parents were born in Mexico. My dad was a doctor, but he was a pharmacist first. He enrolled in the pharmacy school at the University of Texas, which at that time was in Galveston. Met my mother when he went to Galveston to the pharmacy school. So he finished in 25, opened that little pharmacy down on Navigation, and practiced for about 7 years. He started taking pre-med. He got in medical school in 1932 when I was 6 weeks old. So, you know, they had it pretty tough. And that was the Depression, 1932. So then when he finished there, he decided to stay in the United States. He interned over there at Methodist Hospital, and he opened his office back where he had his pharmacy. And he practiced there for about 7 or 8 years, and he built a little clinic out near Hobby Airport on Park Place Boulevard. So I always wanted to be a doctor because, you know, I admired him and I saw how people loved him, and never thought I'd do anything else. I interned over here at Herman, 1957, 58, July to July. And at that time, my aunt went into acute angle closure glaucoma, was put in the hospital and operated on as an emergency to relieve the pressure in her eye by a fellow who was named Ralph Dunn, ophthalmologist, actually he was from Michigan originally. And you know, I got all involved in that since I was an intern over there, and she was my aunt. And got to talking to him and so on. I hadn't decided. I thought I'd go into internal medicine, and but I hadn't really decided, and I didn't feel passionate about any particular field. But when that happened, and he and I started interacting and talking about ophthalmology and this and that, and boy, he was just 100% sold on ophthalmology. He said ophthalmology has all age groups. It has surgery, medicine, neurology. It's wonderful, and you can help these folks, and you can make a good living at it too. So I started thinking about it a lot, and decided that's what I wanted to do. Well, I always wanted to come back to Houston, you know, right from the beginning, and there was never any question in my mind. I wanted to come back to Houston. I wanted to practice at Herman Hospital, because I love that hospital, because they took care of indigent patients as well as private patients, and I always liked that. And they had a residency program dated all the way back to the mid-40s. And you know, so I always wanted to come back and practice here. So I started practice in 1962. The medical school came in 71. So in 1966, I'd been here 4 years. I always liked to teach, so I was very involved in that teaching program over there. And Lee J. Crozier, Crozier, he was a physician, a Canadian physician, the CEO of the hospital. And he really liked me because I got involved in that teaching program. And it was all voluntary, you know what I mean? Nobody was paid anything. So, you know, if you didn't have some doctors on the staff, and they're all busy, you know, who were willing to spend some time teaching these folks, you had a problem. And so anyway, you know, I got all involved in that. So all of a sudden, Dr. Thomas Ruiz, R-O-Y-C-E, who's the chief of the service at Herman, died in 1966, suddenly, had a heart attack and died. And Dr. Crozier pushed the Board of Trustees to make me the chief, even though I was, you know, kind of young there. It was a very busy eye service, private doctors, and of course, you know, some folks that had been there for a long time. So that kind of went over like a proverbial tea in a punch bowl. And but anyway, he did that because he knew I was interested in that teaching program, and the board listened to him. So I was in the chief then when Herman came, when UT came in '71. Well, no, I'd improved that program quite a bit, and we were doing fine. And so I was really pleased to see him come. But I thought, well, University of Texas is a full-time system, and I'll never go full-time. So I resigned as chief. Shevitz Smythe, of course, was the founding dean. So I resigned, and Shevitz said, well, Dr. Ruiz, why are you resigning? And I said, well, Shevitz, I'll tell you. You know, this is a full-time system, University of Texas, and I want to just get out of your way so you can get a full-time chairman in here, because I'll never go full-time. And he looked at me, he said, well, why don't you just stay here and run this program? And I said, well, if you're willing to let me do that, I'll be glad to do that. So he said, yeah. So I never went full-time with UT, you know, never have been full-time. And Shevitz and I got along just fine, and the program got better and better, and of course it was a big boost, you know, for UT to be involved, and it became an academic program, and so on and so on. So it worked out well. So I was the chief of that. I was chairman of the department for 38 years. It's given me a playing field, is the best way to say it. I love the interaction. You know, they're all smart people. You know, they're all doing good work and helping people and so on. So it's great to be involved with those kind of people.